Everyone, hi. Bruce Muffson, LCSW, coming at you once again from SUNRIDGE of Nevada with another live stream. Tonight's topic is about people who have been in juvenile detention centers and have been in psychiatric hospitals. However, I really wanted to broaden this topic tonight because of an article that my producer had sent me about 2 weeks ago from YouTube, which I'll get into later, about a young man in a LA detention facility and the nightmare that happened to him. Tonight, this is for people that have been in the system, that have been in a psych hospital, to share your experiences, as well as for those that think it's a cool thing to do or something that they want to be admirable about it, to be locked up, and to tell you what you can expect. And I also hope that there are parents tonight sitting next to their kids watching this and posing questions and saying, what can I do to keep my son or daughter, because they get locked up too, out of the system? Now, you guys have known already from me from before, from the million videos that we've done already. I'm not into bagging people and saying, yeah, the system is completely horrible and this and that. There are people doing very good things to reduce the number of kids being in the system and trying to help them. And yes, shockingly, there are kids that deserve to be in a psych hospital or to be locked up for things that they did that really are heinous, or really, really need attention. We get that. But this is just for the average person to understand what's going to happen to you, how it will affect your future, more than likely in a negative way, and also then a primer for parents who are going to put their kids into a psych hospital, what to be aware of, what questions to ask, what are you looking for, so that if you have to put your kid in there, you have a better than average shot of having a favorable outcome and not having your kid come back home worse, more aggressive, more violent, and nothing to show for it. So any questions tonight? Tonight is Q&A night. Fire away, fire away. A little bit different than some of our other topics, but that's fine. We want to be creative. We want to be out there. We're doing outreach to give you guys a perspective that you would not find normally anywhere else. Okay, here we go. All right. The question comes, and right now the chat room is empty. So any questions you have, anything, any comments you have, feel free to shoot them in because the board is open. All right. The question that comes up with juvenile detention, because it's a multi-billion-dollar a year system in the United States, is, does it even work? Okay, that's the question that people ask all the time. So, of course, I did my exhaustive research, go from article after article, to bring down some statistics I'm going to explain to people who are, in a sense, on the outside looking in, and things that I've experienced myself from working with kids in detention, assessing them, seeing them, visiting them, and helping to be in a program where we had kids that were inpatient. Okay, number one, you're less likely to graduate high school if you're in a juvenile detention center. There's a lot of reasons for that. Educationally, not as good. There are problems. You're not getting the help that you really need. Depends on the teachers. But statistically, you're less likely to graduate high school. Since an appalling number of Americans do not graduate high school, you don't want to put yourself in that situation where already the odds are stacked up against you. Not a good thing. All right. You're also much more likely to return to prison than if you have alternative treatment like home monitoring, which is becoming more and more popular. So you're more likely, 22% in this article, more likely to return to prison if you've been inside versus something that keeps you on the outside, like mandated counseling or alternative programming. Okay, alternative treatments are such things like home monitoring. What is that? Okay, you might wear a bracelet. They call, juvie jewelry, where you wear something around your ankle to monitor where you're supposed to be. You have to show you're going to counseling twice a week, once by yourself, once with your family. You have to show that you're doing community service. You have to show that you're going to school. So you got to do things that show that you can be maintaining on the outside, not getting into further trouble. That's what alternative sentencing is, and that's gaining popularity around the country. And this comes from Prison Fellowship, which advocates to have less people in prisons for adults and certainly less kids in youth prisons. Okay, remember, the board is clear. Ask any questions you want. Now, here are some more statistics. 40% of incarcerated youth have a learning disability. Wow, what a shock. I could tell you that from working in youth hospitals on an inpatient basis, coming in there to work on, as what they call a per diem, coming in at night, to do groups, individual therapy. A lot of kids that are locked up have problems educationally already. They have what they call a learning disability, meaning they're behind academically. They have problems reading, writing, social skills, social awareness, and being able to take on the tough classes that you need to survive in today's job market. All right. 70% or 7 out of every 10 kids are held for nonviolent offenses. A lot of it is truancy, not going to school. You're going to hear this mentioned a lot about education. Getting into fights with parents, arguing, running away, hanging around with dumb friends and poor influences, smoking drugs, shoplifting, but non-violent offenses. All right, so be aware of that. Number 2, this tends to fall again on people that are going to be Latinos, African Americans, of youth of color. They say here are a third of youth population, yet they represent 61% or 60% of youths that are detained. So a third, now that's 33%, is now almost doubled to 60% of kids that are going to be detained. So already the odds are stacked against you. You don't want to get into that system environment where you get sucked in. Fine. Here's an article from Wisconsin that they say about this. 70%, 7 out of 10, of kids that are held in detention centers were arrested or returned to secure detention with 1 year of release. So the recidivism of you likely to return is 7 out of 10. Why? I'll explain a little bit later, but basically you get accustomed to that world. You're around kids that think antisocial thoughts, antisocial behavior. In a sense, you're getting groomed for an adult life of being incarcerated. But 70% of kids will return within 1 year once they get a taste of what a detention facility lifestyle is like. Like you're learning how to graduate to a lifetime of deviancy. All right. Prior incarceration, meaning if you had been locked up before, all right, was a greater period of recidivism than, hear this, carrying a weapon, gang membership, or poor parental relationships. You think like, oh, I carry a gun, knife, I belong to a gang legitimately, or my parents and I don't get along, we fight all the time, CPS is at our house all the time, Child Protective Services. Nah. The biggest issue that was going to cause you more problems were you previously in a juvenile secured detention center. So already you're getting the kind of the gist where this is all going. In Oregon, okay, congregating delinquent youth together negatively affects their behavior. And again, not exactly newsflash. All right, why? It increases their chance of reoffending. Gee, shocking. Why again? Antisocial behavior is that's all you're around. Okay. Affiliation with antisocial peers and identification with deviancy, like finds like. This becomes your hometown. This becomes the guys you hang out with, or the girls you hang out with. You learn from them. Oh, you got caught shoplifting? Here's how I would teach you how to shoplift better. Oh, your gang didn't like you. Your gang wasn't tough enough. Join my gang. We're looking for guys that like to fight. Oh, you don't go to school. You get high a lot. Where do you get your drugs from? I'll give you my guy and you could deal for him. You don't need to go to school. You can make twice the money you made with that other idiot. You can make a lot more with me. So you're starting to learn all the tricks of the trade, how to get stolen credit cards. You think it doesn't happen at an early age. You're very, very wrong. They start to trade tips. How do you fleece people? How do you mug people? You're learning from the pros because that's why they're there. So you want to get away from that because that's the kind of people you're going to associate yourself with. And let me make this really clear for everyone watching. Who you associate with in your teenage years has a massive influence on what the rest of your life's going to look like. You hang around with the jocks, you tend to be an athlete. Hang around with the studiers, you tend to be a good student. Hang around with the kids that are on the school newspaper, you tend to be a writer. You get the idea. When you hang around the kids that are always cutting school, getting high, getting drunk, engaging in lots of sex, not thinking about their future, cutters, literally cutters, like this. That's who you're going to kind of associate with. And you're not going to have anything in common with the other kids that are actually going places. Think about that from that angle. Again, the floor is clean. Any questions? Now's the time. San Jose police chief had this comment to say. It's a good comment. Locking up kids is the easiest way. But once they get into the juvenile justice system, it's very hard to get them out. It's a great point. Because once you get maladaptive to maladaptive behavior, that's kind of all you know. You couldn't fit in with the jocks because you missed out too much time to play ball. You didn't go. It's interesting. My youngest son really got into high school sports. He joined this team and that team and this team and that team. And I thought, honestly, what could he possibly get from a public school system? Wrong. Those coaches, not every coach was amazing, but I was way surprised by what I saw, but how much he had to train for every individual sport. And the coaches were involved. I'm not saying every coach, but the vast majority were. I mean, they had him working out with weights, they had him running, jumping, doing this, lifting this, running this, picking this up, going to this tournament, got to lose weight, they were involved. And if you miss a season, you're so far behind, you'll never catch up. So I see now what it means to be put time in. You're supposed to take AP classes. You need to take so many to move on. You miss a year and you're with substandard teaching, they're not going to push you, not going to give you access to a great library or to research projects where, other students that are excelling, you'll fail. It's common sense. The race is over before it even begins. And you don't want to go through life that way. All right. So it's very hard to get them out. So true. Okay. Moving forward. In San Francisco, I took this is a long article, but it was different cities reporting different issues that were successful for them. In San Fran, young people in San Fran's diversion program, you see, diversion, not going inside, we're going to divert you, half the recidivism rate of young people who stayed in detention or juvenile justice centers. When you start isolating them, you don't have to go inside. You can stay on the outside. Here's home monitoring. We're giving you a chance. And if you screw it up, you're going to go inside, had half the rate of recidivism. You belong at home. Again, if those of you that are watching with families right now, hopefully there's a couple of parents watching this with your kid. I can't stress this enough. We talk about this all the time. Be involved with your kid. Go to counseling with them. Don't brush it off. If they say your son needs some self-confidence and, he has a lot of self-doubt, be there. Be there encouraging your son or daughter to be impressive. It's amazing on a clinical level how many parents I worked with. How many kids I worked with, and the parents were a no-show. They didn't care. Like, hey, your son or daughter needs you. Or talk positively about them. Oh, she's fat and disgusting. Oh, she's gross. Okay, great. So she'll have negative feelings about herself the rest of her life, and she'll have a hard time having a healthy relationship. Good job. Or make her watch all the kids in the house. Or don't encourage her to do outside activities like sports or, being the school photographer or getting involved on a play. No. Keep them home. Don't encourage them. Don't encourage them to pursue their dreams. Don't spring for a tutor. Don't spring for extra academic help. I'm not saying every parent has that money, but encourage. Bring books home. What are you doing with your schoolwork, honey? How can I help you? Be supportive. So you get the idea now. There is little relation they added on between detention and overall crime in the community. In other words, there was the theme in the 90s, if you locked up more people, crime would go down. Not with detention. It didn't change the overall crime rates in the country. You locked up a lot more kids, but crime did not appreciably go down because it shows you that there are alternatives to just having somebody in detention. All right, here's a biggie. If you got a mental illness, do not go into a detention center. Why? It will make, if you have mental illness, it's going to make it a lot worse. In Oregon, 34% of the kids had significant clinical levels of depression. Now, I'm not knocking every detention center, but a lot of them have a lack of qualified mental health people to really be able to relate to teenagers. So that's usually the kids you got there between the ages of 12 to 18, 12 to 19, 12 to 21. So if you don't have qualified people, that's already a problem. You can have people that are licensed but don't really know what they're doing. So you really got to be careful who's working with your kids. But in general, a third of all kids reported significant clinical levels of depression. Detention has a tendency to put kids at a greater risk of self-harm, meaning thinking about becoming suicidal. Not good. Here's another one. Kids that are detained, all right, with special needs often fail to return to school, will fail to return to school. Why? You're so far behind, you give up. And again, I've seen detention facilities, the teachers try, they do have teachers that come in, they have to be licensed, whatever. But I've been in other places, but that wasn't such a priority. And if you have an educational deficit to begin with, it just grows. It gets bigger, and you're the one that's going to get screwed. You as a kid are not going to catch up. You need those years to catch up, because from 12 to 18 marks you. If you don't get those academic skills down to excel in the next level, you will struggle. Board is clean. Ask any questions you want. We are here to listen. All right. Everyone's, I guess, waiting, breathlessly what I'm going to say next. That's what it is. Okay. Here's another thing. Formerly detained youth, meaning kids, when I say youth, I'm talking about teenagers, have reduced success in the labor market. Again, why? Due to disruptive education. You're taking a Spanish class. You're locked up for 8 months. Maybe the teachers are good, but there's no Spanish class. You lost out. Again, having a second language today is really, really relevant. So your Spanish that was okay now goes on the back burner. You got to play catch up. That's very difficult if you have a special education problem or a special needs problem, or just in general. You've lost out on almost a whole year of not working on your verbs and how to conjugate this letter because you were locked up. Your Spanish will get weaker. You're less competitive in the job market. Not a good thing. That's why I tell kids, don't miss school. Go to school every day. School sucks. The kids suck. The girls are all promiscuous. The guys are all gangbangers. Everyone has a gun. Not always my experience. I've met a lot of bright kids in school too. So it's what you make out of it that's going to determine your success. All right. Detention is expensive. And it's way more expensive than alternative ideas. And it's not cost effective. In other words, what we put into it, we don't get back. It's like, in other words, if you put money into something like, okay, I have a car, I have a new engine that cost me like $1,800. Well, new engine, the car is going to run for another couple of years. I have a new engine. So my $1,800 is going to be borne out by having the car longer, less breakdowns. But we found out that we put a lot of money to juvenile detention. It doesn't give us back money. We lose because we have kids that are growing up that are not going to be successful. If every kid that came out of detention finished high school, go to college, go to military, go to trade school, become a parent, become successful, that's one thing. The statistics do not bear this out. All right. Here's what happened in the 90s when generally in America became this attitude of lock them up, lock them up, lock them up. Okay. What happened? Generally, people who got burned the most were African Americans and Latinos. Their rates rose significantly compared to white kids. So already you're marking yourself. So what's going on now? We need to have reforms, and things have changed a lot since I started in this field. Now, going to be almost a quarter of a century ago. Things have changed in a lot of ways for the better. So I'm not saying everything is doom and gloom, although I'll get to what happened with this incident with Tucker Carlson. There's more of an intergovernment collaboration. I see this now between probation, parole, mental health, law enforcement, the courts. They're trying to figure out what actually works, what doesn't work. They're not so quick to throw away the key anymore. Are there some kids that deserve to be locked up? Yeah, they're dangerous. But there's more of an alternative now if they can help it. They're looking now at data. What does the data say? I'm a big fan of algorithms. Like, don't just say something, back it up. Like in here, you get a lot of statistics that help you explain things, and it help you make a better decision. Don't just say something for the sake of saying it. Is it actually borne out to be helpful? So they're looking at data. Does staying at home work? Does counseling work? Does medication work? Does group therapy work? How much is the parent involvement a factor? And they're starting to look at data and collect it and go from there. Objective admissions screening. Not all kids fit every size. You got to be selective. Some kids need this. Some kids need this. Some kids do better with this. Some kids do better with that. So be objective, and when your screening process, and learn to be more open and eclectic. All right. Alternatives to confinement. What can we do better than to lock somebody up? Is there an afternoon program to return to? If they make a team and they make every practice, can we look at things differently? Can we force family involvement? Hey, mom, you got to get healthy. You got to get off drugs. You got to get off alcohol. You got to be clean. You got to be sober. You got to start working. So things of that nature. What can we do differently than what we've done before that doesn't work? As Albert Einstein said so brilliantly, the definition of insanity is doing the same thing over and over again, expecting different results. So what is their alternatives to being confined? Okay, improve the handling of special cases. A sex offender needs to be treated differently than someone that shoplifted. Someone that's a truant needs to be away from somebody that's actively suicidal. Someone that his father molested and he took it out on his brother when he destroyed some school property should not be with a known gangbanger. Like, you got to kind of figure out how to make it different. Like, don't put everybody in the same situation. I've seen that done a lot of times in hospitals, but it saves money. And when it ends, it becomes like the Thunderdome. Not a good place to hang out, and kids get victimized very quickly. Is this kid likes to fight and he's aggressive and he exposes himself, and your daughter was cutting on herself and she needs to be hospitalized for that reason because she's suicidal. Got to be careful. How do you mix the kids together? So improve the handling of special. I see a lot of times often like, well, they're all the same. They're all the same. And disaster. You got to speak up and say this is not the right solution. Improve conditions of confinement. Kids that get into solitaire do very, very badly. Mentally, they're not there. They have a lot of problems because you're isolated from human contact. They've shown in study after study, even for adults that think they can handle being in solitaire, after a couple of days, your mind literally starts to wander. Everyone's like a tough guy. I'm just going to talk to myself. Screw you, guards. I'll just stare at the wall. I'll do my yoga. I'll do this. It's not so simple. You need human contact. When you don't have that, your brain really starts to drift. You do it long enough, you develop permanent, not like, just semi-permanent psychosis, and you're damaged because you didn't have contact. You get very feral. You're not showering. You're not eating. Where you start, doing gross things with your body. The hygiene gets really, really bizarre. And you start to see things. You get almost schizophrenic. You become psychotic. So you need human contact. And with kids, you need it even more. Okay. And the whole idea also is, again, the board is clean. The board is clean. I got no problem talking. But any questions right now? I know this topic's kind of serious, but I want to really kind of get into this tonight based on the article that was sent to me. We need to invest in juvenile justice programs that work. Not just say, lock them up, abuse them, curse at them, yell at them. What programs actually work, and go from there. Okay. I live in Las Vegas, Nevada. All right. So our county is called Clark County. And what you see in the strip, that's in Clark County. So that's downtown Las Vegas. They have made, to their credit, aggressive steps to reduce youth in detention. I have to give a lot of credit to the current director. I'm not going to say his name. I didn't ask his permission. But they really have made aggressive steps in a good way to reduce kids locked up. And I'm not on the kiddie side anymore. I haven't been really for close to a decade. But I hear and I see and I talk to people, and they've really gone out of their way to avoid kids being in detention. And the numbers have reflected that. Okay, so kudos to them. There's a program here in Clark County called the Harbor, and there's 2 locations. Why is it called the Harbor? It's for the police to bring in kids that are runaways, that are cutting school, that are getting into problems with their family. And rather than the old way of lock them up, take them to detention, they take them to a place called the Harbor. They have people that are there 24/7, or in most cases 18 hours, whatever, and 16 hours, whatever, and they try and figure out insurance. Where can they go? They have a list of providers. Go get the counseling. Go get the help. We'll follow up like a month, 2 months, 3 months, and the vast majority of time, the situation is resolved. Good. Here's alternatives. Here's ways to think differently. Now, is every case successful? Of course not. But the vast majority, since they started putting in the Harbor in about 3-4 years ago, the number of kids entering the pipeline has really gone down. So kudos again to Clark County Juvenile Justice for being aggressive and trying to figure out ways to hold it off at the pass, not to bring kids in. And these kind of programs are creeping up around the country as people understand, you know what? He's crazy. The kid's angry at his father. They've gotten into blows. Police came. Why are we locking him up for? This family needs help. They need to learn how to talk to each other. So here's alternatives rather than going back to the same old that never worked to begin with. So there's some thought going on behind this. All right. There's also a thing called, I'm going to get the acronym wrong, but it's basically like an evening reporting center, evening reporting program, whatever. What this is it tells kids who are having problems in school or not doing what they're supposed to, you got to report here after school. Got to be on the bus, or have your parent take you, and you're there for a couple hours. They give you a snack. You work on your homework. There's supposed to be a group, maybe some individual counseling. Keep it to like 6 o'clock, and then you go home. What they find out from data, between 2:30 and 6 is the most time, is the window when kids are likely to get into trouble before parents come home. Makes sense, because parents are often working. Today, it's a 2-parent lifestyle. You got to work. So the kid comes home to an empty house, problems ensue. But now they're saying you go to this program, you get your homework done, you get some food in you maybe hang out with some friends you make, you talk to the staff, you get things resolved, you go home. Because once it's nightfall, why are you out? You shouldn't be out. You got a curfew. And they find that to be very successful for the kids that take it seriously, not to see them have further problems. It's a good program. And they have them now around the valley. I think there's like 4 or 5 locations. Depending on your zip code, that's where you're going to go. All right. I'm also noticing on the juvie side that the judges, probation and parole officers, mental health, and law enforcement are working together. And it's a collaborative effort now. I see the judges asking these kinds of questions. I see parole and probation asking these kinds of questions. I see mental health people asking these kinds of questions. And I see law enforcement asking these kinds of questions. Because really, anyone that works with kids does not want to see them end up in the system. It's disheartening. The worst thing for anybody working with kids is to see them in as adults, that they made it to prison. They made it into hurting somebody. They made it into doing self-destruction actions. They became an addict. That sucks. And yet that's disheartening. It makes it harder for you to do your job. So everyone now is kind of vested. They're trying to put together family involvement. Families, you got to rise up and step up. You can't blame it on, well, the probation officer sucked and the parole officer sucked and the judge was out to get me. The ADA, assistant district attorney, was a moron. You can blame everybody except yourself. But in the end, you got to take some responsibility. Your kid will respond to how you behave in front of them. Grow up, take it seriously, be a mother, be a father, be a husband and wife, be a team. They say it's the hardest thing in the world to raise your child. Yeah, it probably is. You got to be selfless. You got to give up your life for them. Yeah, okay? If you can't handle that, go to therapy and figure out why you don't want to handle that. And then don't have children, quite frankly. You're not doing anybody a favor having dysfunctional kids breed. Then I end up having to see them, and it's disheartening for me. It hurts my lifestyle, it hurts my mental health. That's not really fair. Be involved. Be involved. Be involved. Family involvement. And I'll say this before, I've said this again. I've never yet met a kid, girl or boy, mostly work with boys, that was involved in a gang actively, that had a father and mother involved. That had a father involved. If there was a father involved, I never saw a kid that was in the system. Nope. They stayed out of it because the father's like, what are you doing? Who are you hanging around with? Where are you going? Who are these kids? Let me vet them. That's the difference. Okay. Look at states as well as data. We're doing that now. What works and what doesn't. Now the states are sharing more. We got a lot better at sharing data. I've said that a few times. And doing the number of kids, doing this, the number of kids has decreased remarkably, and very few are brought back to being part of the pipeline because what's happening is, I think they were saying for every 10 kids that go into this harbor, I think less than one is involved in the system any further. Like I think for every 100 kids, I think it was like a very small percentage, like less than 5% were making it in further. When the old days was arrest them, bring them in, leave them there for the weekend. We'll discuss it on Monday. Court's on Tuesday. Oh, there's no court on Tuesday. I'll have court on Thursday. They're not doing that now. So much fewer kids, because of what Clark County is doing, are entering the system. They're choking off at the beginning at the pipeline, so the pipeline is not getting fed, which is the way you got to look at anything in life, is preventative. I see we got a question. I hate that I missed the beginning of this. Oh, you're doing it again? I'm sure we will. Trust me. Yes. So to answer that question. But what I like what Clark County is doing, because we talk about this all the time in our videos, the clinical stuff I push is preventative. Don't do the same dumb thing again and again and again. Like, what are your alternatives? So what they're doing is they're choking the adult system because it's not going to get basically fresh meat and fresh victims to be part of it. They're saying, like, you don't have to go down this road. And if you do go down this road, you're kind of telling everybody you need to be down this road. So the marginals and the ones that really don't need to be in, they're tossing them back into the ocean. The ones that are truly showing, I'm aggressive, I'm violent, I don't care. Okay, you know what? You do need to come in. All right, fine. What is the whole theme about this? Stay in school, okay? Talk to your parents. Parents, talk to your kids. You do that, that's more than half the battle. I'm going out at 10:30 at night. Where are you going? It's only going to lead to destruction. I'm hanging out with this guy. This guy's an idiot. What's he going to do with you? Oh, I'm going to be with these boys because they're having a party. Really? Am I invited? I like to see what goes on at a house party today. You show up, get your hands off my daughter. Don't give her a beer. You just put something in her drink. I'm her father. Yeah. And she'll be mortified and humiliated and disgusted with you and won't talk to you on the way home. Boo-hoo. Who cares? She'll thank you later. Who cares? We had house parties here recently, and I think 3 or 4 people have been shot, and several have been killed because things got out of hand. I'm like, you know what? House party, 200 people, no adult supervision. Gee, what could possibly go wrong? You know what, honey? I'll put a pair of shoes on. I'm going with you. I don't go with me. It's like it's going to look weird. You know what? It's going to go even worse if you get shot. We'll get into a fight. We'll get stabbed. We'll do something dumb, and I'm not there. I'll go with you. Have a couple of beers. Father-son bonding. I want to see who you hang out with. And if there's going to be any trouble, I want to grab you by the neck and pull you away from it. Let some other idiot get banged. Why my son? Why my daughter? Show an interest. That's it. You know what? Stay for an hour, then we're getting the hell out of here. We don't have to be around this. You know what? I don't get a good vibe out of this environment. Show an interest. Push your kids into positive things. Sports, academics, theater, anything an interest that they have an interest in. They want to be a gymnast. Whatever it is, it's really irrelevant. They want to collect antiques. Who cares? Encourage a passion to make them interested about themselves. Fine. Okay. Stay in school. Stay in school. When you start to cut, when you start to be the class clown, the class RPC kid, you're getting kicked out, it's not going to help you. Stay focused. Find a coach, find a teacher, find a group of friends that are supportive, and they will carry you forward into a lifetime of success. All right. Now we're going to go to a psych hospital. Okay. A psychiatric hospital, which is going to have a kids unit that you can be admitted to because you've been evaluated and you have been found to be a danger to yourself or to others. Again, are there times a kid needs to go to a psychiatric hospital? Yes. I'm not arguing about that. Some kids truly need the help. They need a specialized program. The issues are too much for the parents to handle. They have to go in. We get that. I'm not here to knock anything. But here are the things you need to be aware of as a concerned consumer when you send your kid into one of these programs. And they start a lot younger because you can have a kid as young as 6, 5 years old in a psychiatric hospital. I've seen that. And you could be around kids that could be as old as 19. Here's what you got to be aware of. Your insurance is going to dictate where you go. That's the first thing you got to realize. It's not like I can put my kid here, here, here. I get this a lot from parents. What's the best hospital for my child to go to? I said, what does your insurance cover? That's the first thing. It's not like there's like 8 programs in a city like Las Vegas, so I can pick. No, because your insurance is going to dictate where your kid is going to go. What are you generally hoping to see from your child going inpatient? What are you looking for? Okay, a couple of things. Therapy, like, talk it out. Medication, if they need to be on medication. And it's almost a given they're going to put the kid on medication. It's not like they're going to generally say, oh, let's do yoga, meditation. That doesn't really happen. Change the diet, no. And a change in attitude, right? Talk appropriately. You don't curse at mom. You don't act bizarre in the house. You don't cut yourself. You don't cut school. You don't be promiscuous. And a concerned staff. We're a family. We want the best for your child. And doctor involvement, which means a psychiatrist, that the doctor is involved. Okay. Oh, and by the way, the last article, a lot of the comments came from the Justice Policy Institute, and it was called The Dangers of Detention. I want to give credit where credit's due. All right. First thing you got to do about any hospital that you put your kid in. Okay. I want to buy a new car. I look up online to see the reviews. It's the first thing I do. I want to get a washing machine. What do consumers say about it? I want to go out to a restaurant. What are the reviews? Is the food expensive? Are they big portions? Is the service quick? In other words, you do your homework. What's the best tire to put on your car? Goes from A to Z. Look online to see what you're putting your kid into. But so many parents say to me, if I would have only known now what I knew then, I never would have put her into this hospital. Yeah. So look on Yelp. Everyone's going to have a homepage. Everyone has to. What are the comments made about this particular hospital, this particular unit, and how is the staff seen by people that are reviewing them? Okay. How often is counseling and is it family involved? There should be at least 1 to 2 sessions a week, and there has to be family involvement at the very least 1, if not 2 times a week, because it's a family thing. You got to get some things resolved from the family level. You can have a session with the kid, but there has to be at least 1 minimum session of family contact a week, and at the very least a phone call from the therapist to the family and how things are going. Updates. There has to be a flow. And I worked in a psych hospital for kids for close to I think 10, 11 years. I was always calling the parents. And if they could come in for a family session, great. But if not, I met with the kid a lot. Oh, got a question here. Okay, thanks for your knowledge. How do you help someone who is suffering from depression, other mental illness, and has given up and does not want to get better? I've been encouraging this person for 5 years. Okay, great question. Here's what I would say to a person like this. If they've given up, they haven't because they're talking to you. That's the first step. Secondly, say this to them. You haven't found the right person yet. Don't give up. You don't want to go through your whole life suffering from depression. So what can I do to help you? What can you do to help yourself to find the right person for you? Because as I'll explain, in any time you're in a detention facility or in a psych hospital, and they say, like, I heard this is a really good hospital, Bruce. I heard the detention center is really good. Here's what I'll tell you. Your kid's success will depend, quite frankly, on who they get as a social worker. I'll tell you that right now. I had parents hundreds of times say to me, you saved my kid's life. Thank you so much. And I don't take the credit, whatever. I give the credit to the staff. But I will tell you this, huge amount of it depends on who they get as their social worker. Do they give a damn? Do they care? Who's their probation officer? Who's their parole officer? I've seen a big difference in a lot of people. Are you invested in your kids, or are you just going through the motions? Screw it. The ones that give a damn have better success on their kids' recidivism rate. So I had plenty of parents say to me, you saved my son's life, my daughter's life. You were so helpful. Hey, not a big deal. I always say you did all the heavy lifting. It depends on who you have in your corner. So to answer that question again, you've been encouraging this person for 5 years. God bless you for doing that. Do not stop. Be encouraging. You may be his only real friend that he maybe has. You've been battling this disease of depression for years. Don't give up. Keep on stay in the batter's box. Keep on swinging at pitches. And just say to the person, you haven't found the right person yet. I'm not going to be even like an ego-driven person, but I'll say this. Say to them, hey, there's this website, there's this YouTube channel. Let me check it out. Why don't you check it out together? I'm not saying I'm the answer. Oh, I would have had Bruce years ago. Would have been that's silly. But maybe this might jog something in the person's thinking and their perspective. They can go forward. But don't give up on the person. Keep on being encouraging and just say to them, I just spoke to somebody online. You haven't found the right person yet. That's it. Hope that answers that question for you. Okay. What kind of kids are on the unit with yours? This is big. Okay. Get a tour. What kind of kids are on the unit with yours? If your kid is there because of depression and there was a suicide attempt, where there's a confusion about sexuality, and they're on a unit with a girl who's 4 years older and has been horribly sexually abused, problems. Okay. Is your daughter going to be a victim? What kind of kids is your child with? If you have a family, if you're a husband and wife, and you're with kids, your daughter's with kids, or your son's with kids that are coming from Child Protective Services, that are very angry, very vicious, very bitter, very aggressive, that's not a good fit for your child to be in that environment, because he's going to have to fight, or she's going to have to fight. And don't kid yourself that girls don't fight. I've seen enough girls go at each other that's what happens. So what is the mix of what your child's getting? Does your son weigh 90 pounds and he's 13? And there's a kid on there who's 17 and he weighs 300. And he likes to be sexually active with smaller children. What are the boundaries? Where is the specific understanding of this could be dangerous for my son or daughter to be involved with? And I see this so often, like, they get along, they work together. Not so true. What if one kid is psychotic and you have a child who's dealing with the death of his father? Two different reasons, and they're in the same unit. That's not necessarily going to be clinically helpful for your child. Maybe for the other kid. And, what kind of staff involvement is there to keep your kids safe and protected? All right. Are they staffed with knowledgeable staff? You'd be surprised who gets hired. And they could have titles after their name and letters after their name, but I've learned it's like you don't know what you're getting. And I've seen people do some terrible things. completely inept, out of their league, and they were advising people on making some life and death decisions. So what are you getting? You got to be really careful who you have, giving information out. Are they trained well? Are they taught how to de-escalate, or are they aggressive? Are they undermanned? Are they understaffed? Is the supervisor walking around a lot at night? What's going on? How do they handle situations? So is the staff knowledgeable? Don't be afraid to ask. Okay, here's a biggie. How often is a doctor there to see the kids? That's a big one. A lot of doctors work part-time, where they only come in for their very, very brief assessment or their weekly treatment team. Do they do rounds? That's another thing too people got this misconception about. The old days, yeah, there was a thing that doctors in psychiatry did rounds. So let's say I'm a doctor, I finished my treatment team, I'm like, let's go see the kids in their natural environment. Let me walk on to the unit, introduce myself, how you doing? Oh, they're having lunch? Let me have lunch with them. There used to be that involvement. Now it's like, here are the pills, here's the medication. Are the parents here? They're not here. 5-7 minutes, on to the next kid. How much insurance days do they have left? How quickly do they go home? Like, it's not like you think on TV or Hollywood, where like they spend hours and hours. Not true. They often have second or third jobs. So you're only there as a contract worker, or even if you're a full-time doc. I've learned they're not always there as often as you think they are. So how much involvement is a doctor there? Are they always aggressively pushing medication? Well, the insurance may be saying that for them to stay at the hospital. They have to be on meds to justify being inpatient. Is this the right med for my son or daughter? Why? Is there an alternative to medication? Do they work with you? Do they answer calls? These are all big things you really got to start asking for, and asking during the assessment. So in case something goes south, you can start saying, well, you told me this, this, and this, and I didn't get it. Okay. We try to be protected. That's a biggie. And are decisions made without your knowledge? That's another big one. Because anytime you got a minor under the age of 18, they can't make a decision without parental approval. End of story. That's it. That's a right. That is a basic right to protect you. We got a question here. What do you recommend for someone seeking therapy or counseling after moving to a new area? Are there resources online to find social workers like you? Well, like me, of course not. I'm just joking. But yes, everything is online today. So the first thing to do is, does this person have a job with insurance? That's the first thing. If they do, when they get their insurance card, on the back of their card, they'll say 1-800 number for mental health, so they can call and access that. So it's first driven by insurance. And then you get a list of providers, and you go from there to pick one that you find that you can work with. But everything is online. So if the person has moved to a new city and they're starting a job, they should have, I hope, they have health insurance that covers mental health coverage as well. And from there, you can find out what person works for you, who's in your area, and do they have a specialty. And that's how it works. Yeah, Psychology Today is a great one. And that will give you a lot of answers from there. It's online. Everything is online today. And people will rate them. They'll be rated. They'll be discussed. So you should be able to find fairly quickly someone that works for you, even in a new area. Okay, hope that helps. All right. And are decisions made without your knowledge? That you can't do anything without a parent approval. It could be verbal, of course. Sometimes you can't get a parent to sign something. But are you okay with us changing the medication? Are you okay with us increasing this or decreasing this? Are you okay with them going on an outing? You gotta get parental approval. And if you don't, this thing is done without your approval, massive red flag. You better have a meeting really quickly to discuss that. And that will tell you a lot about how the hospital is run if you're not getting approval, if they make these kinds of decisions. Also, how quickly are you notified if something happens to your child? If they get into a fight, if they get hurt, if there's a suicide attempt, there should be a call on a suicide attempt, on a fight, getting hurt, within 2 hours. You let the family know what took place. Your child was badly hurt in a brawl. We had to take them to another hospital to get checked up. Your child tried to hurt themselves. We were able to save her. She's doing okay. She's resting comfortably. Did they get hurt? They fell off something. They got banged. Your child got a concussion playing basketball. That's fine. Parents will say the same thing over and over again. If they would have called me when it happened, I would not have gotten upset. But because they didn't let me know for like a day, 2, 3, 4 days, I got ticked off. Duh, who wouldn't? So you got to get that sense of, do they let parents know within like a few hours what has happened to their child? And if you don't get that, there's a problem. Okay, here's another biggie. Listen to your child if something is not right. And then you got to complain. And it could be about medication, it could be direction of therapy. Is there improvement? What is the game plan here? Can you treat them at home? Can they come home and do this stuff? You need to be active in their life. When it comes to psychiatric care, I've seen it again. Parents are like, oh, that tells you automatically who cares and who doesn't care. If you're not invested right away with your child every day, going to visiting hours, calling the therapist almost every day, how is he or she doing? Talking to your kid, hugging them, kissing them. Are you okay? You doing okay? Are you involved? The parents that are not involved, I see how the kids do. Terrible. Okay. Use the time to get help for yourself. Are you going to family counseling? Are you doing individual counseling? What are you doing so your kid does not go back to a psychiatric hospital again? Be focused. Be on top of things. And if something is wrong, you get a bad spidey sense, act on it immediately. And you have rights as a parent for your child, and I hope you care about your kid enough to be involved. Okay. The board is clear. Any questions, feel free to shoot them in. Not a problem. All right. Now, here's something I want to talk about. There was a YouTube clip that my producer had sent me, and I wanted to talk about it. This came from the Tucker Carlson show. This came out August 6, 2020. Recent case of how things can go horribly wrong. It was a 16-year-old in downtown LA. They have a big juvie facility down there. I know that. This kid was in there, and he was in there for 2 days. And now we're not talking like 1955. We're not talking 1933. We're talking 2020, not 1994. Today, 2020, just literally 2-3 weeks ago. He was seen by a doctor. Now, I'm sure the incident happened before, but it just happened. It came to light now. 2 days, he's seen by a doctor without his parents' permission. Makes no sense to me. Because we would always have to tell parents when their kids were seeing a doctor. Common sense. Your son's being seen. Normally it's like, this is going to, and you explain what it's for the purpose of. He needs to be examined. That's part of it during the assessment. Okay, fine. Make sure he's okay. But we won't make a medication change without talking to you first. That's common, done. I've had a stack of them this high sign saying that. But letting you know he will be seeing a doctor or an APM, which is a nurse practitioner. That's fine. That's all fine. But if we make any medication changes, you have to approve them. We let you know as a courtesy. Thank you. Common sense. Okay. They gave this kid a diagnosis of what's called ODD, oppositional defiant disorder. Oh, I love my ODD. Okay. You need testing to justify that by a clinical social worker or a PhD psychologist to even justify such a diagnosis. There has to be a lot of criteria for that. Okay, got a question here for a second. Another question, how do you gain a client's trust to open up about suicidal thoughts when both parties are aware of a code of ethics that has to be followed when a serious topic like that arises? Okay, here's the question. Here's a good question. You say to somebody, you don't have to be licensed, are you okay? Are you feeling suicidal? And if the person says yes, you call 911. That's all. Danger to self or others. If I'm talking to a friend of mine and he says to me, Bruce, my marriage is kaput, lost my job, got no money, no self-respect, I'm thinking about killing myself. I'm like, are you serious? Are you feeling about that way right now? Get the guy an out. Nah, man, I think about it all the time. I think about really hurting myself. Hey, bro, I gotta call. I'm licensed. I have to call, but if I wasn't, I would still call 911. You need to talk to a suicide counselor, and if they need to get you an ambulance to get you help. Don't play with it. Don't overthink it. If person's talking that way and they can't give you a reason why they're not suicidal. I love you, my friend. I care about you. You need to go into the hospital. End of story. That's it. Don't hold that guilt on your back that you have to have some kind of like intuitive answer. Here's your answer. You talk that way, you got to go inside. You don't have a plan. You don't have a plan to stay safe, to stay calm. Contact your father, talk to your girlfriend, talk to your boyfriend. You got to go inside. If you're suicidal, you got to get help. Hope that answers that question for you. Okay. So the kid's seen, and they give him ODD. ODD, and one of the commenters said something kind of interesting. He goes, is a lazy catch-all diagnosis. Absolutely. ODD, antisocial. I used to see kids tag with that crap all the time. They didn't ask any questions. What's your home life like? What's your neighborhood like? What are your siblings like? What kind of work does your dad do? Do you even have a father? Is your mother stable? Oh, ODD, antisocial. That kid needs medication. That kid needs to be locked up. She's crazy. Anyone ever sexually offend you, physically abuse you, verbally abuse you? Maybe there's something behind why she's acting like she's crazy, where the kid's off the wall, where they can't control themselves in school or at home, where they're constantly attracting the attention of juvenile justice. Ask questions. But ODD, I rarely, if ever, give that one out, as well as antisocial. Adults, yeah. That's not a problem. Antisocial. Because I see that behavior manifesting itself. But rarely do I give that to a kid unless I really, really see true antisocial behavior. But for me, of every 100 kids, maybe one, maybe two, they really got to justify it. I'll see PTSD. I'll see depression. I'll see anxiety. I'll see stress. I'll see unresolved trauma. I'll see all of that, but I'm not going to throw that down when I just don't see it. There's some of the life factors that are really the factor. Now, again, have I seen some kids that were truly nasty? Yeah. Okay. But few and far in between. Okay. So here's what happens next. There's no testing to justify that disorder, and you need to have testing. What do these guys do? They gave him estrogen. They didn't tell the kid what they were giving him, what tell his parents. Estrogen. I see you got a question here. Pre-med student going to psychiatry. I have friends who struggle with mental illness who distrust psychiatrists, think they do not care. Is there any advice you have in response to this? Yeah, sure. Find a psychiatrist that does care. That's it. Are there good ones? Yeah, I work with some. Are there a lot of bad ones? I work with them as well. Find somebody, go on Yelp, ask questions. Is this doctor concerned? Is this doctor involved? A good one will have the reputation of helping people out. Of course, you want to distrust if all the conversation is about medication and nothing alternative. Lifestyle, behavior, who do you hang out with? What is your diet? Are you exercising? There's a lot of things to consider before medication. Now, does medication not have a place in the table? Of course it does. Some people truly need medication to feel better about themselves. But what else is this person looking at in the big picture? Not just a 15-minute, 30-minute assessment that the insurance pays for. Done. And I think you need to have this antipsychotic, antidepressant, mood stabilizer. People are more complicated than that. You got to put the time into it. And does this doctor take the effort to get to know their patients? I'm not here to argue and bang on psychiatrists. They're under a lot of pressure. They have like 4 people in an hour they got to see in 15 minutes. Insurance is a bone crusher, and it puts a lot of pressure on you to see people worse than a factory migrant worker. But find somebody that makes an effort. And if you're going to have psychiatry, you're going to have medication, find the counselor, find the social worker that knows what they're doing and good at their job that can help your person and help your friends out. Okay. So any questions? Oh, one more shot in. Have you ever heard of a kid? Oh, got it. Sorry. Have you heard of a kid being given this kind of hormone treatment before? Is that a common thing? Was this story an anomaly? it's the first time I've heard of estrogen being given, I'll be honest, but I've seen other things happen where kids were medicated without parental permission, or people made decisions without giving the kid the option to call their parent or even to call an attorney. If they're locked up for, like in my case with sexual offenders, they have right to an attorney. And, sometimes you have law enforcement coming in and want to speak to a kid. Okay, you got to get their attorney's permission first. They're legally allowed to have an attorney. And people will often take advantage of kids. I've seen this with Child Protective Services. They make decisions. So yes, this is the first time I've heard of it. Do I have any doubt there's been medications given without parental permission, or that could have been looked at differently, or that doctors, i.e. psychiatrists, are doing things that were not so kosher, but they're getting paid more money on their Medicaid? Yes. Does every doctor act like that? Thank God, no. But these guys, were women, clearly felt that way. So I wanted to clarify that. Thank you for that question. So they gave me estrogen, not tell him or his parents, which you kind of wonder how, was anyone looking, anyone like hearing this, anyone discussing this? There should be a head doctor there. So what happens? Because their attitude is, which is like ancient history, higher levels of testosterone, because he's a young male, leads to higher levels of aggression and delinquency, because, so much testosterone, which is so bizarre to me. I tell kids who have a lot of quote, unquote, testosterone, a lot of energy, run it off, exercise, work out, be physical. You're a guy. Of course, that's normal. It's not weird. High testosterone levels does not mean you're going to be a delinquent. I don't know where that even comes from. Such outmoded thinking. So it's an unfounded medical treatment. It doesn't make any sense. There's no medical textbook or psychiatry textbook or clinical textbook would even agree with this insanity. And here's what happened. He said he didn't want to take it. I don't know what I'm taking. Understandable. Common sense. I see some questions there. But they said to him, if you don't take it, he could not, you better take it, because he was worried it would affect his upcoming status hearing. If he wasn't taking the meds, he was worried about being screwed over. Like, oh, Your Honor, this kid does not listen. He needs to stay in an extra 2 months. He got problems. Something's wrong with this kid. So where is his attorney? Where is his counselor? Where is his therapist? Where is his unit manager? None of this makes any sense at all. Weird. The whole story needs to be explored more. There's a lot more to this than meets the eye. And you wonder if it's just one kid or like 100 kids. But okay. So he was worried because he's like, I'm afraid if I turn out to be like, I'm not going to take it, I'm troubled. I'm a problem. All right. I got some questions here. Oh, let me go up. Let me just clarify this. He came down with a diagnosis, a medical problem that comes when you take estrogen. It's called gynecomastia, which is growth in your breast area. All right. Because when you take on too much estrogen, that's what happens. Your breasts get bigger. So guess what happened? He's 16 years old, one of the worst years of being self-conscious about your body. Everyone notices he's now developing an A and B cup. What do they start doing? They rip him in the shower. They rip him when he's playing PE. So if he's not suicidal, he's going to be really, really quickly. Hey, nice cup, man. You look good. Hey, are those firm? Can I squeeze them? Look good on you. I imagine how embarrassed he felt. And I've seen boys that I went to like a water park with my kids. I'd see him walking around and I'm like, what? Clearly they were given the wrong medication, because I've seen them having like breasts and it looks terrible. And they're walking around, everyone's staring at him and it's horrible to look at. So his parents notice this and they go crazy. Like, what the heck is happening? And they're furious, they're angry, they're bitter. Who let the ball drop? And now, of course, everyone is being investigated. This is all going on. And there was predictable comments like you guys are saying right now. This is sick. This is crazy. How could this happen? Okay. Once again, this is what happens when you put yourself in that situation. I'm not blaming the kid, obviously. But when you get yourself in these situations where there's not a lot of strong people there to look out for you. This is what could happen to you. And no one's in charge. Nobody's speaking up. That's all. Now, I'm not trying to bag every detention facility, every psych hospital, but I'm saying these things happen when you're in a situation where clearly they ignored every protocol in the world on what happened to how to protect somebody. My advice is don't put yourself in that situation to begin with. Try and stay at home, do what you can. So you never have to worry about something this insane having to happen to you. It's horrible, disgusting. I feel horrible for the kid. He has an attorney now, of course. He's suing. There'll be a settlement. But the emotional damage and the mental health damage to his kid will follow him the rest of his life. So if he wins $4 million, yeah, $4 million of therapy and weed and alcohol and self-loathing and medical procedures and painful breast area. I mean, how's he going to win? Yeah, even if you win, you lose. Even if you lose, you lose. It's not worth it. Horrible what happened to this young fellow and his parents being furious and angry, and understandably they should. Disgusting. We got some comments here. Insane. What the heck is happening to our society? And another one. Yeah, it's of course it's terrible. It's crazy. We're gonna stop him from being a healthy young teenager by showing him and slowing him down, give him big boobs. What? It's crazy. Of course it's crazy. Crazy on every single level. And any one of you that find out more about this story, let me know. I got to do some more digging myself to see where this is coming from and how it's going to play out in the near future. But it did happen in LA County, in Los Angeles. Okay, someone said, hey, I want to thank you. Thank you for watching. Another question, are there ways to approach a parent of a mentally ill child that refuses to see the seriousness of the situation? Yeah, here's your answer. You could do the best you can. Okay, let me clarify that first. Talked to plenty of parents that didn't want to hear the truth. Like, no, my kid, it's not true. We'll outgrow it. So he does this. So he likes to fondle other kids. Where he spits in other kids. Where he does it. I had this a lot of times with parents. They don't want to admit the truth. Where your kid is mentally challenged. Your kid's a learning disability. No, it's not true. He'll figure it out. The teachers suck. The school sucks. It's not my fault. Not my kid's fault. He's always fighting. Talk to the parents and you could say this. You may not want to deal with it now, but if you don't deal with it now, you'll be dealing with it the rest of your life. You will be dealing with it for the rest of your life. And long after you're gone, your child will still be dysfunctional. So you can pretend it's not going to happen, it's not going to affect you, but if you don't jump on this now, you will have a dysfunctional adult child that will never grow. Parents that are smart get involved in something early. I mean, it's common sense again. If your kid's a budding athlete, you spend the money for an athletic coach. You spend the money for a trainer. You spend the money for someone that can teach them how to get stronger, how to get faster. Your kid is brilliant in school, be great in math. Get him a math tutor for calculus. That's going to pay off in dividends down the road. Common sense. Your kid loves to tinker, engineer. Get them into a summer camp where they work on that kind of stuff, STEM, and they work on robots. Help them for the future. The same thing with mental health issues. If you don't want to deal with it now, you will deal with it down the road. There's that old commercial. You can pay me now or you can pay me later. You're going to pay. So I would just say this. Talk to them. Do the best you can, but just simply close with this. I'm just saying, and I feel this way, if you're not going to deal with it now, you're going to deal with it later, and it's going to be 100 times worse because the problem will only grow. Okay. Cool. Okay. So hope that answers your question. So my point is, I know I've been talking for a while. The line is open right now. Ask any questions you want. Finish the topic. Am I shocked at this? Not really. I haven't seen anything as this heinous, but I've seen in my lifetime a lot of crazy things happen to kids in detention and in psych hospitals. Take the advice I give. Be progressive, be open, follow through, be consistent, Be part of your child's life so you can avoid both situations if possible. The more involved you are as a parent, the less likely your kid is to have problems as they get older. Here's the last thing I want to share again and just talk about something. We are continuing to go forward. We want to do different topics. We want to grow. We want you, our audience, to grow with us. That's understandable. If you want to get ahead of us, get a hold of us, it's SUNRIDGE of Nevada, one word. Okay. Number 2, we're gonna continue to do more music breakdowns because people clearly enjoy them. We're also going to do live streams like we're doing right now. It gives us a chance for supporters like yourselves to talk to us. Not a problem. We are still moving forward, trying to get it done, towards developing content on a variety of topics. The first one being how to find a job in this time period, and other topics such as developing self-confidence and self-esteem, and to go more in depth about mental health topics, such as one I'm really going to want to focus on, sexual abuse and what it does to you. On also suicide and physical abuse and trauma, but sexual abuse and the terrible effects of it, that will be discussed once we get a couple of like how to find a job, how to develop self-confidence, how to find better self-esteem. But I am going to be talking about sexual abuse because it's so pervasive around the country and around the world and affects so many people in so many negative ways for a lifetime. Okay, you can always reach out to us. And you can do an email on our YouTube channel or our website. And we're also on Twitter and we're also on Instagram. And as our fans know, if you write us, I write you back. I went through a ton of comments this week. I'm going to finish them this weekend, get back to normal, be up to date with everybody. If you write, we will respond. Any last questions? Okay, last question here. How do you deal with boundaries in your field? Man, good question again. Some good questions tonight. You know what? You can't personalize anything. I'm a soldier, and I'm in the trenches. That's where I'm always going to be. It's just reality for me. And I'm going to see things hard because, quite frankly, that's where I should be. I'm not meant to be behind a desk. I'm meant to be able to be with my troops in the field, seeing things directly. And the boundaries I have is I have to be stable. I have to be normal. I have to be appropriate, and that's how I live my life. I try to. I'm not perfect. That's how I try to have appropriate boundaries because I'm here to try and help people grow, get self-esteem, move on to a normal life, and not be dysfunctional their entire life. Okay. Any last questions? Shoot them in. If not, we're going to call it quits. Give another few seconds. But again, I want parents, please, if you're just a kid and you got a parent that's stable or not even stable, show it to them. Sit down with them. Watch it with them. I want to get feedback, if I can tonight, from parents and children. Did you find this video helpful? Do you find this perspective helpful? Anyone has any more information about that kid's case in LA County, please let us know as well via an email or a comment. And the goal is to get a better perspective of what it's like to go into a juvenile justice system or into a psych hospital, and to be a better consumer and be better aware of what you're getting. Okay, no questions here, so we're going to call it quits. Thank you for watching. Again, Bruce Muffson, SUNRIDGE of Nevada, signing out. Thank you.